Hi there, welcome. My name is Bob Benson. I'm the chair of the Perth and Kinross Integration Joint Board, and this is our meeting set for Wednesday, the 31st of August. Before I move into formal welcomes, I want to remind people that today is National Overdose Awareness Day, and you might already have received information to make you aware of this important day, and it's International Overdose Awareness Day. Buildings in Perth City will be illuminated in purple to mark this occasion and to remember all those individuals and families who have lost someone. Last year, 1,330 people in Scotland lost their lives to drug overdose and 1,245 to alcohol. This causes devastation to family, friends, and local communities up and down our country. It's a shameful record, as many of these deaths are preventable. To help support International Overdose Awareness Day, we have a backdrop here, has been produced, which is on our MS Teams screen, and you can see that it says, "Time to remember, time to act, end the stigma, end the silence." Grateful if you could share this beyond this meeting, but also it just underlines for me what the work of the Integrated Joint Board is about and why it's so important that we are addressing these issues in our work. So thank you. I'm now going to come to formal welcome and apologies. Now, Scott, our clerk, is at home today, but he's online. I'm not going to take a round because we already have names of those who are already within this room and those who are online. It's quite a time-consuming business, as you'd appreciate. So we already know who is here. So welcome to you all, and thank you for your deliberations on the papers. Do we have any apologies that we need to note for today? Okay, just to also make you aware that we will be joined for two papers later on by Dr. Keith Russell and Dr. Peter Lefevre to discuss the mental health services and the update on redesign of substance use services. And I also have a special welcome for Emma Fletcher, who's the Director of Public Health for NHS Tayside, who will hopefully be joining us at some stage today. She tells me she's on call, but there will be, Scott will raise this as a formal nomination for her to join the board. Thank you. Before proceeding to the main items, are there any declarations of interest? Thank you. I'd like to move on to the first of our presentations for today, and that's on Perth and Kinross Partnership, the HIS Joint Inspection of Adult Support and Protection Public Report, August 2022. Jackie Pepper, our Chief Officer, is going to do a presentation on this. And in addition, of course, you'll have read the fairly substantive paper that's already gone with this. So, Jackie.
Thank you very much, Chair. It's with pleasure that I am here to introduce the report that you've all received a copy of, which was published on the 23rd of August 2022. And that was a report of a joint inspection of our multi-agency adult support and protection services, and that took place over June and July of this year. It was carried out by the Care Inspectorate, Her Majesty's Inspectorate of Constabulary and Healthcare Improvements Scotland. The inspection findings are positive, and the hard work and determination of staff across services over the last 2 years is recognised in this report. The report shows that there are strong multi-agency arrangements in Perth and Kinross, strong partnership working, and that this is keeping adults who are at risk of harm safe and protected. These key strengths are leading to positive outcomes for vulnerable adults. It's important to recognise that a whole range of staff across the Health and Social Care Partnership were involved in supporting that inspection, providing information, and throughout the period of inspection, there were no adults reported back to us through a protocol that's adopted by the inspectors. There were no adults reported back to us as being at immediate risk or where they had concerns about their immediate safety. And that's a credit to the workforce across Perth and Kinross and the work that they're doing to keep adults safe. There were two key questions, and you'll see those in the report. The first question related to how good are our key processes for adult support protection. And the inspectors concluded that these processes were effective and that there were clear strengths supporting positive experiences and outcomes, and that those strengths collectively outweighed areas for improvement. The second question was around how good was our strategic leadership for adult support and protection, and the inspectors concluded that strategic leadership was very effective and was demonstrating major strengths. The inspection methodology itself included 5 key proportionate activities, including a whole range of documentary evidence, and the Integrated Joint Board was provided with a copy of the position statement at the outset of the inspection. There was a staff survey conducted, and 346 of staff from across the partnership responded to the staff survey. The inspectors then went on to scrutinise social work records into 40 adults at risk of harm who did not progress beyond adult support and protection inquiry stage, and 50 adults in relation to health, police and social work records where that adult protection journey had gone on to the investigation stage and beyond. And there were further staff focus groups at the end of the inspection. And you'll see in the report the key strengths are listed throughout, and it's really just to recognise that independent finding of the strong self-evaluation and quality assurance processes that exist across the partnership, and the collaborative and involvement of partners in information sharing, screening concerns and the triage arrangements to ensure that appropriate actions are taken to protect people. The strengths of the interagency referral discussion processes, which have been brought into being during the pandemic, and the positive impact that that's having on practice, and the work of the care home oversight group in Perth and Kinross in their support of large-scale investigations and supporting residents in care homes at the height of pandemic is also noted. So real positives in this inspection report, however, we're not complacent, and you'll also see in the report a huge number of key areas for improvement highlighted throughout, and these are synthesised down into 3 key areas. One is about improving the level and availability of independent advocacy, and also improving the direct involvement of adults in need of protection and their carers in our key processes. Those are key recommendations from this report. There was also a recommendation to be more consistent in how we consider the need for adults to undergo medical examinations where appropriate, and a recommendation around improving recording of assessments of risk and the actions that flow from that. It was very much around recording of those assessments rather than the quality per se. So members of the Chief Officers Group for Public Protection and the Adult Protection Committee are working at the moment to develop an improvement plan. That improvement plan will be submitted to the inspectors in October, and the Chief Officers Group held an online engagement session only yesterday to engage with staff directly in relation to their responses to the report and to ensure that they're involved in the development of the improvements that will be taken forward. So moving forward, the Care Inspectorate has a link inspector, and the link inspector will continue her engagement with services across Perth and Kinross, and in particular education and children's services in relation to children, but also health and social care partnership in relation to the support for adults in need of protection. So I think that just concludes and sums up the report. A very positive report, but with some key areas for learning to take forward. And I have to say that the engagement with staff yesterday, they were very modest. I think it was the word I used to Kenny this morning, modest in the sense that they understand the gravity of this, and that actually this really is, in my view, their report, and a report that emphasises their hard work, particularly over the last 2 years, which has been, as you know, the most challenging of circumstances. So thank you very much.
Thank you very much indeed, Chief Officer, and we're really blessed by your previous experience in social work and in Care Inspectorate to enable us to have got to this place with staff. It's an excellent report. This is for awareness, but I'm happy to invite questions for the Chief Officer. I have one question here from Beth Hamilton, and Adam's going to keep me posted on. Beth, you go first, please.
I just want to commend the report and to also highlight that what I find is particularly positive was the element of the sharing of information and the confidence of different agencies to share data and information, and I thought that was particularly valuable because one of the biggest problems that occurs is a lack of sharing of information across agencies, and I just wanted to commend that that is an important part which was highlighted. So well done, thank you.
Thank you, Chair. It's a comment really, and not dissimilar to Beth, in that I wish to really highlight the positivity within this report and the attention that each individual has taken to ensure that adult protection is very much everyone's responsibility. I think, as the Chief Officer highlighted, this has been a time of global pandemic, so to maintain quality standards of this level at a time of extensive challenge for all interdisciplinary integrated team members, it just goes to show the depth of commitment that they have to this agenda, notwithstanding, of course, the improvement items noted. Thank you.
Thank you, Chair. I mean, like others, I just want to commend Jackie and the team for the report. It is a positive report, lots of good messages to take away from it. I had just one question, if I may, around there's the statement, the involvement of independent advocacy was mixed, and you touched on this in your comments, Jackie. Can you give me some information on the provision of independent advocacy services across Perth and Kinross, and particularly in the more rural areas? Is there sufficient capacity there to provide the services that are needed?
Thank you very much for your question in relation to independent advocacy, because I think the report tells a story of this isn't just about offering that service. The number of people who were taking that up it falls away quite quickly. So it's, and those people who do take it up benefit from it greatly, and there's also evidence in the report that that is actually making a difference to the way in which they are able to be protected and the planning around that. So it is key to very effective adult protection processes and beyond. So we do commission independent advocacy from Independent Advocacy Perth and Kinross. And as a result of this inspection report, we will review that and look at both its sufficiency in terms of quantity and how we can improve upon that in terms of the quality of that support for a whole range of individuals, because those people within the adult protection system cover all ages, from, it could be 16 plus up right through to very old people. So we need to make sure that we have that, all of those needs covered within it, but we will review it.
Dr. Sally Peterson. Sally.
Just a sort of comment about, first of all, congratulations on the report, but also I just wanted to congratulate you.
Oh, is it me?
It was just, I mean, obviously other members have said about congratulating the report. The thing I would like to also congratulate you on is actually how well you advertised this, so that there was engagement across staff. Because I saw it on lots of different forums that I'm involved with, which I think really enables people to then give the true opinion of frontline staff. The other thing is, I think with these reports, there are always consequences that you don't think of. And I'd just like to say that on the back of this coming forward and this report being done, I've seen a huge amount of discussion about this area in other forums that we might not have recognised. So, for example, as a GP, I've noticed there's now a real interest on the back of this of us looking at what our processes are. Do we have the correct training? So although we have a great report there, I think there will be subsequent ripples from this report that will really benefit sort of the vulnerable people that this covers.
Sandra Auld.
Thank you very much, Chair. So like others, I'd like to congratulate and welcome this report. A comment was made earlier regarding the importance of sharing of information, which was timely in some ways, in that it's something I absolutely concur with, and the management of all patients really depends on the exchange and sharing of appropriate information. As service user representatives, Ian and I have had 3 examples brought to our attention and asked to raise for discussion instances in 3 separate instances where people have either moved into the area or moved out of the area to other boards, and there's been significant delays in the transfer of their medical notes, both hospital and GP notes or GP notes, which has led to delays and sometimes quite marked delays in their care being able to be continued. So it was just really something to raise for the IJB's attention. Thank you.
Thanks very much, Sandra. I'm going to pass that to Jackie to respond, please. Thank you.
Thanks very much, Sandra, for raising that. Happy to pick up the issues that are raised in the 3 cases that you mentioned, which is around those transitions when people move in and out of different areas. So, and I think that would be really helpful feedback to ensure that there's discussion across not just the Adult Protection Committee, but we consider the wider issues as well. So happy to pick up on that, and perhaps we can take a discussion away from today to do so. Thanks.
Thank you very much.
Thank you. Ian McCartney.
Thanks. Thank you, Chairman. I found the report quite illuminating, particularly when I came to live here. You wouldn't have been able to write a report like this in terms of integration and engagement with users and their families. There's still obviously a lot to go because it's at the beginning of a journey, and this report sets out what that journey needs to be. And from my perspective as an enthusiastic amateur in these areas, I'm happy to send a note in, but there's one or two things that could have been in the report which would improve our knowledge. For example, on large-scale investigations, it'd be quite useful to know not the persons of what happened, but simply what the investigation was and what action you're taking within the plan. And that's important to show if something does arise, you get the capacity to deal with it and do deal with it. And on the improvement plan, the protection improvement plan, it would be helpful from time to time to get an indication of where that plan is and how it's working out, and whether this board needs to support you in other measures. And so that was the kind of questions I had. And also about workforce issues. The workforce has been under tremendous pressures, and not just at COVID. The service itself provides huge pressures, particularly those who are in it who believe what they're doing is the right thing. But it would be helpful going forward to have some understanding of just how many people in each area are working, because I might be quite surprised that you've only got 6 doing this, but this is what they've achieved in this area, and whether we can look at how we can help to improve and tell a positive story about the activities. And so that hopefully is helpful in the response.
Yes, thank you, Chair, and thank you, Ian, for your comments. I think in terms of your comments around the integration journey and large-scale investigations, the Integrated Joint Board usually receives an annual report from the Adult Protection Committee, and that's towards the end of the year. So I think in terms of engaging with Bill Atkinson as the independent chair and Ian Wilkie, who's the coordinator for the committee, we can make sure that some of that's addressed in the information that comes forward to the Integrated Joint Board, just to cover that off. And in terms of the workforce issues, I'm just going to ask Kenny to say a few words, because Kenny was at the engagement event yesterday, where we had a lot of discussion around what does that mean for people who've been working really, really hard, and what's the impact on them, and really just beginning to understand their perspective around that. So there certainly was a discussion around that yesterday, and a commitment to engaging further on that, so that we are absolutely assured we have not only sufficient resource, but we have supported staff within that too. Kenny?
Yes, I mean, there's well documented pressures on frontline staff in terms of police, health and social work, but certainly from the social work side, we have secured funding for 9 additional full-time social worker posts which are currently going into the system. They have been advertised. A number of the posts have been filled internally, though. People have taken the opportunity to move from one team to another team, so we haven't actually increased the numbers, but those posts are being advertised again, so we will be increasing the capacity. And a significant amount of those new posts in terms of their remit will be supporting adult support and protection. And we have recently just revamped our training procedures. We're involved in Tayside-wide training developments as well, just to help newly qualified workers with their adult sport and protection training, and also refresher training for existing workers as well. And also, looking, next step is to look as part of the improvement plan as well, just looking at the support for managers as well, issues like chairing case conferences, etc. So, a range of actions in the improvement plan plus the increased capacity that's going into the system.
Sandy Watts.
Thank you, Chair. Thank you. It was just a quick comment about independent advocacy. Picking up on the earlier point, I should declare an interest in that, as well as being the third sector rep on this board, I do chair the board of the independent advocacy in Perth. The independent advocacy has been working at full capacity right through pandemic and continues to do so, including the rural areas. I know that was part of the question earlier, but they do cover the rural areas as required. We looked at this report last week, and one of the things we were particularly talking about was how we could improve the take-up of independent advocacy by those people who might benefit from it. And one of the issues we thought was that sometimes people don't realise fully just what benefit the service could be to them. And we'd be very interested in taking those talks further and discussing ways that we can actually help more people. That was it. Thank you.
Thanks very much indeed, Sandy. And I think that's even more important, given that as we move into really difficult economic and social times, the pressures on families and individuals will be enormous. So it's good to hear that we're going to have hopefully additional staff to support that, but also I'm thinking about the third sector role and what support we can give to them. Jackie, I don't know if you want to finalise this, and I'm also going to ask Graham if he wants to ask a question as well. He's just posted something on the chat line. Jackie, do you want to go first though?
Just like to say thank you very much for your positive comments, which we will feed back to staff. Staff whose work is reported in the paper that you've received, and also I think the comments that we received this afternoon in relation to some of the information that might come back when we bring forward the report from the Adult Protection Committee in terms of its ongoing improvement work across the year. Some features that we will include in that in order to assist the Integrated Joint Board with its work too. So thank you very much.
Graham, do you wish to ask a question?
Well, it's just a minor observation. It is a very minor one. And it applies to a number of issues that may well be raised. As an academic with an interest in how surveys are used and abused, just citing the number, and it is 346 staff, is a little meaningless. It's much better if you can cite response rates. In other words, how many staff were surveyed and how many responded to the survey, because it's, as I've given a little example there, if it's 387 from 400 employed, I can have a great deal of confidence that what's said here is reflects the views of staff. If the denominator is very much higher, I can have almost no confidence. So it's just it's a technical issue, but it's a very important issue in how you present data.
Thanks very much indeed. And you may very likely get a further call on this, Graham, from some of the staff involved in gathering that kind of data, and for your advice on it. Thank you very much indeed. Don't have any further questions on this. Maureen.
listening. I would just like to highlight some of the areas for improvement, one of which is, the involvement of unpaid carers in all the case conferences. It doesn't always happen, and I think it should happen in every instance where there is an unpaid carer. Also, some cases are listed there where everything is not actually recorded, and to emphasise the importance of recording everything that happens, because it's all information that can be used to assess what's to happen. And finally, on the last page there, it says that Perth and Kinross Partnership have been asked to prepare an improvement plan to address the priority areas for improvement. And I wondered if there's a timescale for this and how it's going to be monitored.
Sorry, the improvement plan will be a multi-agency improvement plan. It will be built into the Adult Protections Committee's ongoing improvement plans, so it won't be sitting separately. It will be part of their ongoing work. So, and in terms of the monitoring of that will sit with the committee itself. And we have an annual report that comes back to both. It goes to Perth and Kinross Council. And it's reported to the IJB. So the monitoring of that improvement plan, you will see that when that report comes back to the board here, and you'll have an opportunity to ask questions and scrutinise that then.
Okay, thank you. Thank you very much indeed, Jackie, for the presentation, and thank you for the excellent range of questions that have been placed back to us. Welcome, and the gentleman who just arrived, I don't know you. Right, thank you. I'm Bob Benson, I'm the chair. That's okay, welcome. That now takes me on to the next item, which is the minute of the meeting of the Perth and Kinross Integration Joint Board of the 27th of June for approval. Can I check with members whether the accuracy of the minute is there, and then I'll move to approve the minute thereafter. So any comments for accuracy? No, I don't see any. In that case, could I move to approve this, the minute? Could I have a proposer and a seconder, please? Donald, Sarah. Okay, thank you very much. That then takes us to the action points. And just for your information, the first action point 131 is the Chief Finance Officer is going to talk to that, but she's also going to overlap that with action point 138 as well. Thank you.
Good afternoon, members. And yes, in relation to actions 131 and 138, they are very much linked. And in response, the development of a long-term financial framework for mental health services in Tayside, I'm sure you would agree, needs to be developed very much hand in hand with the development of clear strategic plans. Jackie's update on mental health services that will be considered later this afternoon sets out the progress that's being made and setting the conditions for progressing strategy development. And the CFOs across Tayside, along with the Director of Finance for NHS Tayside, are working closely with Jackie and Director colleagues to ensure that the financial framework is developed in tandem. And indeed, a further meeting is to take place next week with Chief Officers, Directors and the Chief Financial Officers to consider the key principles to support the overall process and the development of the financial framework.
Thank you, Jackie. 137, review of mechanisms for ongoing IJB member communication to ensure effectiveness. Jackie, please.
Thank you, Chair. As we struggle with the synchronisation of our mics. Yes, thank you for this. I would like to thank Councillor Stewart for his retrieval of a protocol that was a draft, or certainly a draft protocol that was put together some time ago, and I'll be working with the communications teams in NHS Tayside and Perth and Kinross Council to bring that up to date, and hope to have that at our next meeting in October. Thank you.
Thank you. And then that takes us to item, 139 action point 8.2. Chair and Chief Officer to meet to agree appropriate next steps in relation to public partner representatives around the voting status of public partners. How this can be raised at national level. Chief Officer.
Thank you very much, Chair. I know that we've had some continuing discussions with public partners over the last few months in relation to this particular issue. And we have a proposal that to consider the amendments that have been made to the standing orders in Angus IJB, yes, and for us to consider whether that's something that we would be able to adopt or adopt with some amendments for this particular IJB. So that's a matter that's under active consideration at this point in time. Thank you.
Thank you very much. Thank you very much. Oh, sorry, Jackie. You need... Mike, I think. Maureen.
I would like to thank Colin for taking up and championing the cause of voting rights for public partners and that, you know, because it's something that's been a bone of contention with some public partners for some time. And I was surprised to hear about this amendment to standing orders in Angus, because the public partners in Perth and Kinross, Dundee and Angus all meet about every 2 or 3 months and share things, and this was never brought up. So unless it's a very recent thing, I've no idea. Have you had that confirmation about that?
It was agreed at the Angus IJB at the end of June.
It's just I'm surprised that it wasn't shared, you know, because all the public partners in Tayside meet and share information, and that would have been helpful to know that they had done that, you know.
Is now an ongoing matter, not just in this particular area, but quite a lot of other areas as well, not least being mental health. And that would be one of the important changes I think you may see. I think I've already started to receive correspondence and updates from Angus IJB, which have been really helpful. And so I will see that as an ongoing piece of sharing of information, because it's really important as we move forward. But we intend to bring this forward. Hopefully we can get this matter resolved by the next IJB meeting, and Jackie's nodding her acquiescence on that, because then we can look at both the local situation as well as the national situation as well. Yes, sorry, Ian.
Yes, thanks for the report back. Are there going to be one of the 4 of us invited to attend these meetings to discuss what proposals coming forward, which I think is essential as it relates to us?
Just to say yes, and we're already doing that through our public partner regular meetings that we've been having, and I would wish to have gone through that process with public partners before we bring a paper to the next IJB. Hope that gives you reassurance.
If I could apologise, Chairman, given that we discussed a range of issues at that meeting, which is always a good meeting, but I was referring to the discussions that will take place with yourselves over what either the standing order or whatever other suggestion comes up. But during those discussions, at least one of us should be there to express a view, rather than coming here done and dusted and suddenly all your good work starts to fall apart because we say, well, that's not what we were looking for.
I hadn't anticipated that you wouldn't be involved in that way. If it's going to have credibility, then it needs to have gone through that process. So I'm sorry if that wasn't made clear, but that's always been clear in my head that that's a process we're undertake. And I expect to see, I use the term, quite intensive consultation with public partners on this, not just on paperwork, but on the discussions that need to be with it. Because there are a range of issues that are involved here. And part of that is much wider as well in terms of how we work with the ongoing role of public partners, full stop. We've already referred to the standards document, as you know, that I raised before. So we'd want to bring this all together as a kind of more complete package, I think would probably be better, so that we can then see it in that kind of broad way. I hope that satisfies you, Ian. Thank you. Sandra Auld wants to ask a question as well. Sandra.
Thank you very much, Chair. So just to follow on from that a little bit, would it be possible for you to share the paper from Angus or the communication from Angus, just so we can have sight of what's being discussed, please? And also just to say that following on from discussion at the meeting before last of the chair and chief exec, the meeting that you're referring to, the meetings you're referring to, Ian and I had taken it upon ourselves to gather together some information about the role of the service user public partners and how the election process took place and how the role was advertised and the role of the reference group, with the intention that once updated, and that's what's taken the time. As we started to do that, we realised that some of the documentation required to be updated. The intent was to share that with members of the IJB for information. So that is just to highlight that process is almost complete now, and that information hopefully will be ready to be shared fairly soon.
Thank you very much indeed, Sandra, and I can assure you that all the information that we have will be shared with you.
Thank you.
I think I know that some people had received the Angus papers, which had come from Councillor Bell from Angus to Colin and I, and I'm more than happy to ensure that you all get that. I just assumed that you already had that, but we'll ensure that you got all of the paperwork of that. And
Thank you
also
very much.
address some of the questions that were also raised at previous IJBs as well. Thank you. Are there any matters arising that are not agendaed? Okay, thank you very much. In that case, we now move on to membership update. Scott.
Thank you, Chair, and good afternoon, everyone. Just to update on a couple of points in relation to general board membership. We continue to have a vacancy for a voting member from NHS Tayside Board. However, I'm advised by the clerk to the board that we should hopefully have a nominee or somebody into that post as soon as possible. One other point to make in relation to membership, in which you alluded to earlier, Chair, was regarding Dr. Emma Fletcher, who's the Director of Public Health at NHS Tayside. And the proposal is that the board move to appoint Dr. Fletcher as a public health representative on the Perth and Kinross IGB as an additional non-voting member. So the board are just asked to ratify that appointment today. Thanks.
Can we therefore ratify the appointment of Dr. Emma Fletcher, the Director of Public Health? Approved. Thank you. Now takes us to governance and 8.1, which is the Perth and Kinross Integration Joint Board Directions Policy. Jackie.
Thank you very much, Chair. I'm pleased to bring forward this report and the accompanying policy and procedure, which updates our current position for the Integrated Joint Board and brings this in line with the revised integration scheme, which was approved by NHS Tayside and Perth and Kinross Council at the end of June of this year. It also takes account of the statutory guidance on directions published by the Scottish Government in January 2020. I'd like to pay particular thanks to Sarah Roger, who is Legal Services Manager in Perth and Kinross Council and an advisor to the Integrated Joint Board. And I'm pleased that Sarah is with us today online, as Sarah has she has had most of this policy is actually an account of her hard work, so thank you very much for that, Sarah. The directions provide integration authorities with the mechanism to action their strategic plan, and what that does is bind the Health Board and the Council, or both, to deliver on that plan using the integrated budget available. And IGB members will see in Appendix 2 that directions have been issued in this way, and the policy and procedure that in front of you today further strengthens the approach that we've taken to date by widening the use of directions across all our business, enhancing our governance arrangements and ensuring that directions are formulated to deliver the change that we're trying to achieve. It gives a clear statement of partner responsibilities and provides an enhanced performance monitoring and widens the remit of the Audit and Performance Committee to monitor progress. We know that more work is required to take account of the more complex arrangements that arise from the lead partner role in terms of delegated health services, and a short life working group with representation from the 3 IGBs, NHS Tayside and legal advisors will commence this work on Friday of this week. That's the 2nd of September, with the intention that that work will be concluded by mid-October in time for the next Perth and Kinross Integrated Joint Board meeting on the 26th of October. So the IGB is asked to approve the policy and procedure at Appendix 1 and for this to come into effect from tomorrow. It requests that, and to request that an addendum in relation to this policy is brought back for approval to the next IGB on the 26th of October. And you're also asked to note the requirement for us to amend our template for reporting in order to give prominence to directions and to comply with the policy. And also to note the intention that we will devote time to putting this policy into practice for IGB members at the development session, which is planned for the 14th of September. Thank you.
Thank you, Chair. Jackie, I would again commend this paper. I think it's a very useful reminder that we really do need a structure and a framework around the work we're doing with the partner organisations. The one thing that I just wanted to ask about is the communication of directions to the partners, and I mentioned, we talked about this before, but I think it's important that, you know, the way that this is worded, it's once approved written directions and the associated IGB report will be emailed within 7 days to, you know, both council and NHST side. And I would just like some reassurance that around that is about, this won't come as a surprise to those organisations, that behind the scenes leading up to that, there will be a lot of negotiation and agreement. Because nothing will work unless we actually all agree what we're looking for and how we're going to deliver it. So that is just the governance aspect of it, but we will be working behind the scenes to make sure that these are all agreed in advance and we don't send something off that nobody's expecting. Thank you.
Other questions? Do you want to respond to that, Jackie? Sorry.
Thank you very much, Beth. I think you raise a really important point, because I think what that does is set down the importance of collaboration and working this through along with a whole range of other people to ensure that the directions are reasonable and can be implemented. You said don't come as a surprise, but that's about saying, you know, are they reasonable? Is it the right direction to take? And can they be implemented in the timescale that has been asked for? So if we as an IGB are being much more detailed and specific around the directions, then there's a whole chain of work that needs to come in advance of that. And I see my role and Jane's role in particular around the finance are going to be very key to that. And it's that very the complexity around the lead partner role, where you have multiple parties who need to be involved in that process, that we wanted to take time to do that and to set that out in a flow chart that actually is something that people can refer to, and what is the formal mechanisms for that. So thank you.
Councillor Stewart.
Thanks, Chair. This is, I think it's maybe a follow on from Mrs. Hamilton's question, but this policy is about the IGB considering whether a direction is necessary, making sure that it contains all of the information it needs, maintaining a log of it and issuing it. Do NHS Tayside and Perth and Kinross Council have an established mechanism for implementing directions? You know, once they receive a direction, what do they do with it in terms of changing the way that the services are delivered? You know, communicating that out, you know, cascading that down through all of the departments and heads of service down to the team leaders and people on the front line.
I'm going to say something, and then perhaps Sarah might wish to respond to your question as well, Councillor Stewart. In the terms of issuing directions and the response to that, that's where I think my role becomes quite complex in there, because it's very much, will very often and most often be a direction to me in my role as Chief Officer, as a Director of both NHS Tayside and the Council, to put that into effect. And that's where it might sound as if I'm writing a report to tell me what to do, but I'm writing a report to the IGB to tell my employers, if you like, in that director role, to ensure that those services are delivered in the way that's specified by the IGB, so it actually makes it happen, because the IGB doesn't employ staff and doesn't have the resources to do that. So Sarah, you may be able to explain that better than I can.
Hello. No, Jackie, I think you've explained the challenges around the issuing of directions and why there has been across the country some difficulty around the issuing of directions, because it does sometimes appear as if people are directing themselves, particularly the chief officer, who sort of wears different hats at different times. I suppose my general answer to the question would be that, you know, the implementation of directions within the partner bodies is something that would be governed by and scrutinised under their own, governance arrangements, whatever they may be. And then downwards, I suppose, through, for example, Jackie as Chief Officer, but also as a senior member of staff in the council, being responsible for her area of the services that are being delivered and being accountable to the council for how those are delivered. So that, I suppose that's my answer to the question, is that, existing governance arrangements would be used to ensure that directions are complied with. But that may be something that needs to be considered further to make sure that that is robust enough.
We are fortunate that we've got a development session coming up on the 14th of September, where we're going to go through this more thoroughly, but it raises as many questions as the report proposes, and I suspect it's probably not going to be as straightforward as we think, and particularly around timescales as well, I would guess, is another part of it, and resources. But thank you very much indeed, Jackie, and to Sarah, for the preparation of this paper. In the absence of any further questions on this, can I, without having to go through the recommendations, can we agree the 4 recommendations that are there? Thank you very much. That now takes us to delivering on strategic objectives, and the Chief Officer is going to give us a strategic update as a verbal update. Jackie.
Thank you very much, Chair. I'm going to keep this brief, but pleased that there's an opportunity in this agenda to provide a strategic update to the IJB members, and to continue to do that as a formal mechanism of keeping you updated on key matters. And since the last meeting of the IJB on the 27th of June, it's fair to say that both members and the Health and Social Care Partnership management team and staff across the partnership have been pretty busy over the summer. It's technically a recess, but we've been very busy. There's been 2 induction sessions held for all members, one in July and one in August, which have been well attended and beneficial for those who participated, and they've included both new members and members who've been more longer in their service to the Integrated Joint Board. So that's been helpful. There was a joint briefing session for IJB members and members of Perth and Kinross Council, elected members, on the 26th of August in relation to the National Care Service and the implications of the National Care Service Bill, which is at stage one in the parliamentary process. You've heard already about the Adult Support and Protection Inspection, which was carried out over June and July, heavily supported by members across the Health and Social Care Partnership, as well as the Adult Protection Committee. And the Chief Officer, that's myself, accompanied both the Chair and the Vice Chair in meetings with the Independent Oversight and Assurance Group into Mental Health Services, and a discussion on the theme of integration and the role of the IJB in relation to strategic planning and the scheme, the integration scheme. And the mental health update addresses some of the key issues that were shared from their observations and insights so far. I'd also like to advise the Integration Joint Board members that delayed discharge continues to be a key challenge in Perth and Kinross, with system-wide improvement work underway, covering the continuum from acute primary care and into social care. And it's my intention to bring forward a report outlining the key challenges that we're facing and the improvement work that's underway and the intended impact of that in due course. So that's my brief strategic update. Thank you.
Yes, I'm on. Thank you. Thanks, Jackie. And it's probably just worth reminding folks that Jackie's only been informally in post since May. So, and I keep on reminding her about that and as well. So there's been tremendous progress, and as you can see from the reports, and we'll see more of that when we come to talk about mental health services in particular, about how much progress has actually been made. And I'd like to commend her for the work she's done so far. And also just to say is how supportive she is to the work of the chair and to the board as well throughout this period too. It's a relationship I immensely enjoy. Thank you. Are there any questions on the briefing report itself? I don't see any. Thank you very much indeed. Now we're slightly ahead of our time. I believe we have Keith Russell and Peter Lefevre joining us about 2:30ish, is that correct? That's right. So we're just, what I'd like to do is to briefly cover the strategic planning group minute and then take a break about 1:15ish, and then we'll be ready to start. Hopefully Peter and Keith will be here. So can we move therefore on to 9.4 strategic planning group minute from the 17th of May.
Hello. Hi, I'm just giving you an giving you an update on the minute from May 17th. We actually did a briefing of that minute at the last IJB, Bob. So the action note that's underneath it is in relation to the latest SPG meeting that was held around communication and engagement in the self-evaluation activity that's been undertaken. Would you like an update on that?
Yes, please.
Okay. So we're undertaking a self-evaluation of our community engagement activity to date, and this has been coordinated through the mechanism of the strategic planning group. It'll take place over a period of 6 months, ending in January 2023. And there are 3 domains that we will be covering. These domains are dictated to, or not dictated to, but are detailed within the Health Improvement Scotland Quality Framework. There are 3 domains, the first domain of which is called ongoing engagement and involvement of people. The second domain is involvement of people in service planning, strategy and design. And domain 3 is governance and leadership, supporting community engagement and participation. So at the strategic planning group on the 16th, we looked at domain number 1 and collated feedback, and that has subsequently been sent out to the membership of the SPG with the ask that they circulate that within the organisations and groups that they represent, to be returned back to us again to discuss at the next strategic planning group meeting. We will give an overview of that, but we will also move on to look at domain number 2. This is an iterative process and will be continued throughout the self-evaluation activity. That, in addition to the additional intelligence that we hold from inspection activity, etc., will allow us to reflect on activity to date, but more importantly, to plan how we undertake this activity moving forwards, ensuring that the voice of people is threaded throughout our future design and planning activity, and how this activity will contribute to our strategic decision making and therefore our commissioning activity, and should align itself well with the recommendations within the National Care Service and the Feely Review with regards to an ethical commissioning approach, co-production and prioritising human rights within our planning and co-production and design of strategy. And I suppose that's all that I have to feed back at the moment. At the next IGB, we'll give you a full update on all of the feedback collated from multiple stakeholders involved.
Thanks very much. Do we have any questions? If not, can I ask a question? How are the agendas formulated for these meetings? I know you're the chair, Jackie, and Zoe's the vice chair. How are the agendas formulated, and to what extent is there co-production within that agenda setting?
Generally speaking, to date, the agendas have been formulated on the basis of papers that are coming to the Integrated Joint Board to allow stakeholders to participate in terms of their involvement of what those papers look like. The last two strategic planning group meetings have focused on very specific pieces of consultation that we've been asked to undertake from a national level, but on a local basis. So the agendas have been subsumed, I suppose, with that activity and directed to by my Chief Officer Jackie as well. We acknowledge that the strategic planning group meetings to date have been happening probably too close to the integrated joint board meetings, and so for next year's meetings we've asked that they've been scheduled further in advance so that all groups that are represented on there, including the reference group and carer strategy group, have plenty of time to participate in the formulation of reports that then come to the IGB, and that's an area of improvement that we've identified that we want to take forward.
Thanks very much indeed, Zoe. I don't have any questions, so thank you very much indeed. And thank you to all of the strategic planning group members who are involved in this work, and we greatly appreciate this. So that then takes us on to, I think we have a pause for a break for about 10 minutes, and then we'll see if Peter and Keith can join us at that point. So can we switch off the recording? Thank you. Thank you very much indeed. We're now back online again, and I believe some of our outside guests are coming to be involved in the next two papers are now here. And yeah, thank you. And so therefore, I'm now going to move on to 9.2 mental health services. Jackie, do you want to introduce this and introduce our guests as well, please? Thank you.
Thank you very much, Chair. I'm pleased to bring forward this mental health services update paper to the Integrated Joint Board and have this included as a standing item going forward. In my Chief Officer role and as lead partner for the strategic planning for inpatient mental health and learning disability services, I've also provided a report with very similar content to the NHS Tayside board meeting last Thursday. So I recognise that the provision of a system-wide and comprehensive report is still a work in progress. And would be very keen from this meeting to receive your comments on how that comprehensive reporting can be achieved for the Perth and Kinross IJB and its role. This paper covers three main areas. Firstly, a position in relation to inpatient mental health and learning disability services, and I'm very pleased that Keith Russell, as Nurse Director for Mental Health and Learning Disability, and Dr. Peter Lefevre, Operational Director for Mental Health and Learning Disabilities for NHS Tayside, are with us this afternoon. And that section of the report is to assist the Perth and Kinross IJB with oversight in terms of its role as set out in the integration scheme. Secondly, there is an update in relation to the early work that I have taken forward in respect of my role as lead partner in relation to the coordination of strategic planning around inpatient mental health services and learning disability services. And thirdly, there is an updated position in relation to listen, learn, change, the progress there, and the role of the Independent Oversight and Assurance Group and the work that's underway and the work that's being reported to them as they are coming to a conclusion of that work and their expectations going forward. So thank you very much, Chair.
Thank you. I'm going to open this up for questions, and Jackie, if you could invite people to address various issues that are going. One's obviously related more to nursing, one will relate more to medical side. And if we could now open it up for questions, please. Donald McPherson.
Thank you, Chair. Thank you, Jackie. I think it's good that we're getting this report starting to come forward now, and look forward to reading it in future meetings. There were a couple of questions that came to me as I was reading the report. I mean, first, you know, there's quite a bit of information around delayed discharges, and clearly this is it's a difficult problem, I think, across all of our services, but it's also an issue here. So linked to that, what are we actually doing to address that specifically in mental health? And there's discussion about surge beds, and I'm not quite sure that I know what a surge bed is. So could that maybe be explained, and also an indication of how long a patient might actually be in a surge bed as opposed to whatever would be called a normal bed? So those were my questions. Thank you.
Thank you very much, Donald. You're quite correct in terms of the challenges around delayed discharge, and this report at section 2.23 sets out the particular the details around delayed discharge, and separates out the numbers in relation to acute admission and rehabilitation from a mental health perspective, and the number of delayed discharges as they relate to learning disability, and the proportion across the Tayside authorities. And although these numbers are very small, they relate to patients seeking discharge from hospital in very complex circumstances, in the sense that they require very complex packages of care to enable that discharge. And so the challenges in relation to each of these individuals will be probably unique to them, but certainly we're working very hard locally in Perth and Kinross around ensuring that we have the capacity within our social care system to support that, and trying to look at new models of care. I think that you've seen previously come to the IJB to support that, but they do remain challenging. And I would ask my colleagues who are joining us from NHS Tayside if they would like to add anything to that, and also address your point around surge beds, because they're probably better placed to answer that than I am. I wonder if Keith Russell would like to come in, and Dr. Lefebvre.
Chair, thank you. Thank you for the question, Mr. McPherson. I think I would echo Jackie's feedback in relation to the work that's underway in Tayside. We're very conscious that each number is a person, each person has their own life story, and each person really needs to be living a life beyond the constraints of the hospital environment that they find themselves in. So as a collective, we're also aware that it takes a whole system at times to meet people's needs. It's not solely in the gift of a health board or other service at times to be able to do that. So across Tayside, we're working with each of the health and social care partnerships and other providers to actively plan and pursue discharge for people who are delayed. It's not a position that as a board we are comfortable with or seek to maintain, because of the very real impact it has on people. I don't know if Dr. Lefebvre wants to come in on that point. I'll stop there, and then we can pick up a discussion about surge beds if Peter's got anything he wants to add.
Yeah, I'll just add there's quite a number of delayed discharges that are for more complex, intensive inpatient facilities. For example, specialists, low secure facilities, which are only available on a national basis, and there is a national shortage of this sort of accommodation, often within the private sector, purely because of the small numbers in each health board. So there is a national perspective over how these facilities are best commissioned, and we are finding ourselves, in a difficult situation of even, considering placements in England, which again is strongly under pressure. So it is a mixed thing. These are common issues to most health boards, the delayed discharge, but it does cause an inordinate problem within an acute care facility, because patients are obviously in a facility which isn't really meeting their longer term needs and has a big throughput of patients, which is disturbing for somebody who needs more settled and longer term care. So yes, it does need a real focus on what we can do locally within our health board areas to provide specialist supported accommodation, bespoke packages of care, but also some national commissioning for specialist services for, you know, where that needs to be met within a national facility, for example, low secure care.
Thank you very much. More questions, please. Ian. Oh, sorry. Surge bed question.
I'm happy to come in on that, Chair. It's not the best description, a surge bed. A surge bed is essentially every ward has a funded establishment, a number of beds that are funded with staff to provide care. A surge bed is a bed that is beyond that funded establishment where additional staff have to be brought in to provide care and treatment and support for that individual. We've identified a small number of surge beds across our service. Some are in existing bedrooms because some of our wards have more bedrooms than are funded for use. And in some of our other wards, there are non-bedroom areas. We work very hard to make sure that someone is in a surge bed for the shortest space of time as possible and are accommodated in a bedroom within their ward as quickly as we reasonably can.
Can I just come back on that very briefly? What do you have a policy on the maximum length of time that someone might be in a surge bed? Because I can understand it being a short-term necessity, but clearly it's not the ideal solution in anything more than short-term.
Thank you. There's a standard operating procedure in place which identifies the steps that have to be taken before a surge bed is used, and that requires escalation and senior decision-making support. The use of the surge bed doesn't prevent the commencement of care and treatment for the individual. So it's not that they're accommodated outside of a ward, they're accommodated within a ward. So care and treatment can commence. It's just that it's in a bed beyond the funded establishment of the ward. So in custom and practice is such that people are accommodated normally the next working day into a funded bed within the ward.
Ian McCartney.
Thanks, Chair. Could I ask a question of our colleagues of new models of care, where you're up to and how many types of new models you're looking at for what services, and have you introduced any yet and assessed them for their value? And do you need additional resources at some point to introduce some of the new models of care? And do they cover inpatient and outpatient?
I can certainly start.
Sure. Peter, I'm just going to say something, and then you may wish to come in after that, if that's okay. I think, Ian, I've just taken on the new role as lead partner, as you know, and later on in the report you'll see that the programme board that is working towards achieving the changes and the transformation that we need to make needs to do some more work around that. I suggest that in terms of some of the detail around it, we can bring back at a future date in terms of an update, because we know that this is going to be a standing item at this meeting, and I'll bring that forward once I'm more fully engaged in that work, I think, Ian, if that's helpful.
Before I bring in Councillor Frampton, I think that this comes back again to the importance of our engagement and visits, so that we can can actually see what the real situation of people's lives are, and the real situation for staff as well in these situations. Thank you. Councillor Frampton.
Thank you, Chair. My question is relating to the residential rehabilitation of substance abuse users, page 84. It says on this that everyone leaving the residential rehabilitation will have a recovery worker allocated to them to provide ongoing support. I'm wondering how this can be fully implemented when the mental health services, as they stand at the moment, is extremely stretched.
Councillor Frampton, I think that's the next paper.
Oh, right.
It's okay. No, don't worry. I've done it before myself. I've got. I'll make sure that you're on hold, Colin.
Sorry, just to clarify Councillor Frampton's question a bit. Although she's referring to the next paper, it is about the impact that has on because people are being appointed in the substance use service, they're to be appointed mental health workers. But there's already we're looking at the papers which show the delayed discharge and the access, problems that there are within the mental health paper. So it maybe is actually a relevant question for this one.
Okay, Councillor Frampton, was that explanation where you wanted to steer the question for this paper?
Yeah, because it kind of took place over the both papers.
Jackie, do you want to?
Thank you. I'm thinking, Councillor Frampton, that this might be something, again, I'm not sure we have the right representation to answer your particular question. I'm looking at Kenny Ogilvie as the author of the next report to see whether he feels he can answer that, but it may be something that we need to bring forward at a future date. Thanks.
I mean, certainly in terms of residential rehab for people with substance use issues, the numbers of people accessing that are fairly low in Perth and Kinross. I think that the next report that refers to figure is under 5, and that's for confidentiality issues. And we have recently increased the capacity in our integrated drug and alcohol rehab team, and we have specifically recruited 3 recovery workers. But that's to supplement additional staff as well. So certainly as it stands, we do have the capacity to allocate a key worker to everybody for when they return back to their local community from residential rehab.
Okay, thank you. Can I take Councillor McCall, please? And then I'm going to take Sarah Dickey and then Councillor Stewart.
Thank you, Chair. I think perhaps Ian may have touched upon the comment that the question I want to ask, and it's about how does this report and the work that's going on for inpatient services impact upon and influence a strategy for outpatient services, because I don't think they're separate and divisible. And equally it goes towards Councillor Frampton's question about how does one strategy for one part of the service impact on the strategy of the other. And as a general observation, it might be worthwhile in these reports coming forward that there is some cross-reference to related reports that impacts one upon the other. But my main question is around the alignment with outpatient services, and particularly around prevention. I mentioned earlier on in the comments that I'm a member of the Adult Protection Committee. And one of the things that is really important there, particularly when you look at case view, is how do we ensure we can learn lessons that will prevent things in the future? So prevention, for me, prevention of the requirement for inpatient services is just as important as delivering the inpatient services themselves. And that therefore requires a significant alignment with outpatient services that needs to be seamless. And equally, when people are discharged from inpatient services, we can't just forget about it and say that's the job done, because very often patients are then transferred to outpatient services, and if that isn't working effectively, they then become inpatients again, and it's like an ongoing, ever-repeating Groundhog Day, unfortunately. So I'm just curious to know specifically around this paper, what is the alignment with inpatient services and how do we ensure that it's a seamless process for our citizens? Thank you.
I think that's a question for the Chief Officer.
Thank you very much, Councillor McCall. In my introduction, I was indicating that this was a report that was a work in progress, as it doesn't fully reflect the work that's going on within community mental health teams and across our communities more generally. So in order to give that full picture, that's something that we need to work towards. So yes, I agree with you. And I think that comment also refers it is apt in relation to the question around models of care, because this isn't just about developing ways of working that at that acute level, but across the system. And Peter, I'm not sure if you would want to say anything on that.
Peter, can you hear us?
Yes, absolutely correct. Sorry, I started speaking before while I was muted. Absolutely correct. In outpatient services, and particularly multidisciplinary teams, need to work really efficiently and proactively with prevention, particularly for those who are most likely to use inpatient services, those with the more significant and complex and severe mental disorders and illnesses, which often require quite intense multidisciplinary care planning. Across Tayside, we do have community mental health teams, but they're very broadly spread, and the remit is, the demands on the service are pretty huge. We have successfully developed, or are developing, the primary care mental health services because that's really recognised as a gap across Tayside, to prevent the more severe and significant illnesses from happening. Of course, many illnesses can't be prevented. Illnesses like schizophrenia are always going to appear, irrespective of any prevention we can do. But the care services obviously have to meet individual needs. We are embarking on a major community mental health team redesign, as there is a recognition that we can do more, particularly for the more complex, severe and enduring patients who to focus more, I think, on the prevention side. And that is a challenge with the workforce issues within the community mental health teams and the increasing demands. And we know, for example, across Scotland, that COVID era has led to an increase in across the board of 10% of detained patients, which are would be the core remit of community mental health teams. So demand has definitely gone up for this group of patients, and we do need to really focus on increasing recruitment, retention of staff, and a redesign of the community mental health teams to focus particularly on those who are most at risk of relapse, needing that prevention work to then positively impact on inpatient services. There does need to be that integration across the inpatient and acute sector. Continuity of care is important, and so key workers in the community need to also be able to provide input and follow up on the inpatient side, because these are the professionals that patients have developed close relationships with, and that's in focusing on those areas will have an impact, even for brief periods on inpatient stay. If we can get people moving properly out to the community quickly and promptly. We have got more work to do, and we have got challenges. So, and it is a whole system approach. We need to also invest and develop crisis services in addition to, as I say, the primary care mental health. We have made progress over the last few years. You know, we've got examples of national importance, particularly sort of an example being the nuke in Perth, which has been really focused in on as an exemplar team. We've got similar services developing and have developed across Angus and also in Dundee. So it is very much a work in progress. And I think one of the questions was about monitoring, and we clearly need to monitor and make sure that is having a positive benefit. We do know that sometimes actually the services can have a negative benefit on admissions. For example, if you increase crisis assessment without the necessary community infrastructure to support people after that assessment, it can lead to increased admissions. So it's a whole system approach that we need to make sure is developed, as the Chief Officer says, we'll be able to report on developments subsequently. Thanks very much.
Thank you very much. I know that Councillor McCall may wish to have an additional question, but I wondered if we could bring in Evelyn Devine firstly, who's responsible for community mental health teams, and then come back to you, Councillor McCall. Is that okay?
That's fine, thank you.
Evelyn.
Yeah, I think Peter's probably covered most of the sort of work that we're taking forward in Perth and Kinross, Councillor McCall, and in particular designing our primary care community mental health services for mental health and well-being. So we have a proposal that's gone through to Scottish Government, and we're awaiting funding imminently for that type of service to come forward. We already have some community mental health and wellbeing nurses attached to GP practices through Action 15 funding. So we've been testing that sort of response to support GPs in the community and access to mental health services and to counselling services as well. So that's underway. We have invested as well in distress brief intervention for Perth and Kinross as a Tayside-wide service. So that's only beginning to embed at the minute. So we've got a bit of work to do in terms of communicating that service and consulting with it. So all on the way. As Dr. Lefevre said, we are looking at a redesign of our community mental health services, and in particular because they are a catch-all service at the minute. They were set up to deal with chronic and enduring support for people, but they are a catch-all, so everything is coming through to them, and we really need to redefine what they do, and we may need to think about commissioning for other conditions in a different way, like ADHD, for example, and how we do those assessments. We know we have a bit of a backlog of assessments, and working hard to put processes in place to support that. So, but very much linked in with the Tayside-wide programme. We're not doing things in isolation of the direction of travel in relation to the Living Life Well strategy. However, we do have key things that we want to focus on within Perth and Kinross, and primary mental health being sort of one of the main ones for us at the minute, and the redesign of our CMHT services moving forward.
Councillor McCall.
Thank you very much. That's very encouraging responses and very fulsome. Thank you. My additional comment, Chair, if I may, is around people with, you mentioned ADHD, Evelyn, but there's also people with other types of intellectual disabilities. Those of you who sit me with the Adult Protection Committee, I have, without any evidence whatsoever, but my anecdotal view is that very often young people who come out of the school system with additional support needs, very often there's a bit of a void, and I just know some circumstances that have come to me as part of my casework where after a few years those young people then require some mental health services, but there's a gap in their continuity of their support all the way through. So that's maybe somewhere to look at. But my main comment I wanted to make was around the support of people who have learning disabilities and those who are particularly supported at home by third-party providers. And those providers don't seem to be part of this narrative that is in front of us today anyway, at least as far as I can see, in terms of being able to spot if something isn't going right, if there's a potential crisis forthcoming. Very often people with learning disabilities and other intellectual disabilities, whether it's ADHD or whether it's somewhere in the autism spectrum, have some difficulty in communicating how they think and how they feel, and enunciating that. So I think there's somewhere there that perhaps in fullness of time and in due course needs to be considered as part of the overall journey, and to understand how we work effectively there. I do know that very often those providers who provide care at home are very good. Some I know have actually started employing mental health nurses in their own organisations, but it's not consistent across the board. And so therefore, but also very often the staff at the front line who are visiting people very often individually in their own home, and might be the only person who a service user may speak to at all with any frequency, may not necessarily have the training or the sometimes the backup in their own organisations to be able to identify potential mental health issues that are coming in. Very often it's when they reach crisis point that people are then referred to either outpatients or in worst case then inpatients, because they've gone beyond the point of support and they require inpatient care. So that's just a sort of general observation that's part of the whole conversation. I mean, you mentioned the NUC, which does excellent work, but that's just one organisation that's quite focused. But there's lots of organisations that aren't crisis organisations but provide day-to-day support. So I think we need to think very carefully about how we involve the third sector, and also how we listen to carers and those sorts of people who are perhaps supporting people at home as well. So that's quite a big comment, Chair. So thank you for your indulgence.
Thank you very much. I'm normally seeking brief questions, but thank you.
Well,
I'm also aware of your knowledge in this area, Councillor McCall. Thank you.
It was a
and
comment.
That's an area I would have highlighted as well.
Yeah, it's a comment rather than I don't expect answers right now today, but it's really just a comment, an observation of the whole thing. But thank you.
Thank you very much. Thank you. I appreciate that. Evelyn, do you want to say anything briefly, and then Jackie's going to come in again around commissioning, I think.
Yeah, I mean, I think we do recognise some of what Councillor McCall has said to us, and we do need sort of further engagement with our third sector colleagues in and around some of the transitional work in particular. I know there's some work that's gone on through the development of our Scope LD team, which is really focusing in on transitions as well to support with learning disabilities. But in relation to mental health, of course, the investment came in through CAMS for that 16 to 25 age group. So, there has been additionality there, but it's how we work with CAMS, which is a service that sits within NHS Tayside. So it's that connection to them as well. So we can sort of look better at transitions. They are represented on our mental health strategy group, but it's how I think there's more work to be done there, to be fair.
Thank you. Jackie, do you want to finish off this part before I bring in Sarah, Dickie and Councillor Stewart?
Thank you very much, and it's really just to address your comments in relation to the involvement of the third sector, Councillor McCall, and I'd just like to commend the work that's been done to support the development of our local mental health and wellbeing strategy group. That's jointly chaired by Christopher Lamont, who's on holiday today, and Wendy Given from the NUC itself that has already been mentioned, and there are a range of third sector partners involved in that steering group. So they are very much involved in our local planning around our community health and wellbeing strategy. And I'm not sure if Zoe wants to say anything around commissioning at this point.
If Zoe's not there, we can come back to that anyway. I'd like to go on to Sarah Dickey, please, and then I'd like to finalise with Councillor Stewart. Thank you. And Maureen, I'll take one more question after that.
Thank you very much, Chair. Just some observations on the paper that would be helpful for me to have some clarification on in terms of the choice of some of the language within the report. So my first observation is under section 2.2.5 in the workforce and staff wellbeing section. And I'm noting that recruitment and retention continues to present challenges across the inpatient learning disability service. And I'm very much aware that nationally this is an issue. So I would like greater clarity on the recruitment and retention. I'm very much aware that the Mental Welfare Commission has on the 19th of August wrote to Mr. Kevin Stewart, the Minister for Mental Health and Wellbeing, to express the concern about the impact of staff shortages in mental health and learning disabilities and the impact that has on the quality of care and treatment for patients. I don't see any reference to staff wellbeing in that section, although it does talk about the workforce recruitment. There's no note of the interventions regarding staff wellbeing. My second observation refers to the section under 2.2.1. And again, it's just an observation on the use of language around the choice of who provides assurance. And I would suggest that the Executive Nurse Director wouldn't provide assurance on clinical care and governance matters to inpatient mental health services, nor to provide assurance reports to the meeting of NHS Tayside board, and that those would be reports for information or for other purposes as opposed to assurance. Thank you.
I'm going to take the first part of the question, which was around about recruitment and retention. Peter or Keith, could either of you make comment on that question, please?
Chair, I think we probably both comment from our respective professional backgrounds. I think the word challenge undersells the scale of the issue that we have in terms of recruitment in mental health services across Tayside. From a registered nursing perspective, we've got significant vacancies across a number of our teams. The paper sets out some of the steps that we're taking to create different opportunities, bring new skills into the workforce, and also to retain the undergraduates who train at Dundee University and Abertay. So it's something that is the golden thread that runs through many of our discussions. Workforce really has to be one of our, and is one of our primary concerns. In terms of well-being, Sarah's observations are absolutely right. I think we need to commend the ongoing efforts of the mental health workforce across health and social care in terms of continuing to deliver care to people across our various communities. Sarah, we're again focused on the everyday well-being of staff and how we support them through continued professional development, supervision, and other opportunities so that they can remain resilient and maximise their potential. But I think the report could be developed in future to cover a bit more of that in detail. I'll stop there on nursing, Chair, and Dr. Lefebvre may come in around psychiatry.
Peter, do you want to pick up that opportunity?
Yes, thank you very much, Chair. Yeah, it's within the medical staffing, it is a national recruitment problem or national shortage of psychiatrists. It goes back a long way to really about 25 years ago when there was a big increase in the number of posts, a big expansion in the number of consultant posts. And that hasn't, and I think in retrospect, you can look at a relative lack of workforce planning in order to sustain the increased workforce with new staff, and trained staff. So it remains a national challenge. Obviously, some of the Tayside focus, I suppose, and scrutiny that mental health services have been under has not been a particularly good draw for recruitment, and I think that is probably underlies where that we are finding it more of a challenge compared to other health boards. However, it is a national problem, and we're all health boards are competing against a very small number of doctors who are, I suppose, in circulation and looking for jobs. From a national perspective, it has been highlighted to Scottish Government, both at, I've been highlighting it regularly during individual sessions. The Mental Welfare Commission, as has been reported, highlighted it also to Mr. Stewart 2 weeks ago on the back of their work across health boards. We're actually hosting in Perth in the Murray Royal a meeting of all the associate medical directors in mental health to discuss the workforce issue and the use of locums and how we can have a national focus to see if there are things that we can do. Ultimately, I think it is going to be a refocus of what consultants and what doctors are able to do, and where can a more limited workforce be best placed. That will involve sort of much wider considerations of workforce redesign, which will be challenging, particularly, as I say, there's the challenging recruitment for nurses as well. So we need new models of care. We need to look at where consultants are best placed, and that will have wider impact. So it's not going to be an easy process across the health service, including primary and secondary care. So it's going to be an ongoing work in progress. On a positive note, it does look like more training places are being filled, and it looks like, in a 5 years' time, the medical workforce will be improving, but that is a long time ahead. So we definitely need to look particularly at workforce redesign and service redesign to move forward, certainly for these next few years.
Thank you very much. And I'm going to just bring in Jackie just to reiterate a point about inpatient services and say something about assurance.
Thank you very much. I'll address the first point in relation to workforce planning, and just to remind the Perth and Kinross IJB that our 3-year workforce plan that was approved in June does not cover inpatient services for mental health, learning disability and drug and alcohol services. So I would suggest that, in line with the oversight role that the IJB has, that we ensure that that's included in reports going forward. And secondly, in relation to your correction, Sarah, in relation to the role of the Executive Nurse Director, I agree that there is a misrepresentation there in terms of the executive lead role as set out in the integration scheme, and it's for the Executive Nurse Director to ensure that there are reports on clinical governance and to every meeting of the NHST sides Care Governance Committee and to the board. So I'm happy to correct the report on that basis. Thank you.
And Sarah will ensure that that's properly recorded in the minute as well. Okay, thank you. Now I've got, I'm kind of conscious of time here, and I've already got 3 more questions to come, and there's another offer as well. So I'm going to go to Councillor Stewart first of all, but I wonder if we can be brief, please, rather than make statements, if that would be possible, because we've got another big item after this.
Thanks, Chair. I have a few questions, but they will be quick fire. On 2.2.5, I was wondering what the medical nursing split of the 32 NQPs is.
Councillor Stewart, they're all newly qualified nurses.
Okay, thanks. And I'm going to presume that in the 4 assistant nurse, is that assistant nurse practitioners, or should that be advanced nurse practitioners?
Assistant.
Assistant, right, okay, it is. I think just quickly on that section, something that might be missing there is so we've got 32 newly qualified practitioners coming in, but we don't know how many vacancies there are or what the total establishment is. You know, is it 32 out of 320 vacancies, or, you know, is the total establishment, you know, 40 or something like that? So just for future noting. On the patient feedback section 2.2.4, I was wondering whether the number of responses April to June last year was 64, but that did include Murray Royal as well, and the number this year is 14. I was wondering whether 14 is a, going back to Professor Martin's question before, if that's a statistically significant number to sort of base conclusions on. And also, one of the things that continually gets reported is, certainly in the press, is about lack of access. So just to make the point that this, these numbers are for patient feedback for people who actually manage to get in, but if there are capacity issues or flow issues, then there will be people who maybe should be getting in but don't, so it's not incorporating their feedback. Sure.
Thank you. Keith.
Councillor Stewart, I agree with you. I think sharing this single snapshot of data is helpful, but not hugely helpful. There's a annual report 2021 to 2022, which sets out the feedback over 234 responses from people, and that gives us a percentage return rate of between 27 and 44% of all admissions over that time. So again, that might be something that would be better shared than possibly quarterly updates. I think your point about feedback in other areas is well made, and I think it's something that as a service we've got to think about in terms of how do we access feedback more routinely from people who are trying to access their service or are experiencing services in non-inpatient areas. So I'm in agreement with that, and it's work for us to consider.
Thanks very much. And then finally on 2.3, question for the Chief Officer. She has had advance notice, but there's mention of the a review of the terms of reference of the Mental Health and Wellbeing Programme Board, and I was just wondering what the existing terms of reference are. Maybe they could be circulated, but where does that programme board sit in any governance structure currently? Who does it report into?
Thank you very much. I'm happy to circulate the terms of reference for that board as it currently stands to the members of the IJB. Currently, the programme board has not been reporting directly to any of the IJBs or to NHS side, and that's something that needs to be reviewed, and part of that the changes and improvements that need to be made here.
Thank you.
Thanks very much. Maureen Summers and Sandra Auld. And if I know that Sally's trying to get, you might want to put something in the chat and we'll pick up on that, okay? Maureen.
I would like to just highlight 2.4.2 where it was highlighted by the Independent Oversight Committee that conflated outputs and outcomes were instances where red, amber and green status had been misapplied, and this would require a more consistent, rigorous approach to assessing the current position. You know, we've come across, as we've been heavily involved, when I say we, I'm talking about stakeholder groups I'm in that have people with lived experience in it, and we have challenged some of the RAG ratings that they have applied to some of the, you know, the recommendations that they say have been completed, when in actual fact they're not. Even ones that have been partially completed are not even partially done. So that needs to be really looked at, and I would just highlight as well what Colin was saying there about this chart here. It doesn't really say very much at all, because we have 14 responses there and we get a 50% satisfaction with the inpatient services, as opposed to 64 responses who give a 31%. So to me, it doesn't really tell us anything that, like, you know, we need organisations like Plus that stands for service users and that, you know, to do another survey. They did one 2 or 3 years ago when there was, you know, talking about Murray Royal, you know, transferring all their beds and that, you know, and centralised at Carsview. So we need, you know, an organisation like that to do a survey. I'd also like to ask, and I think Jackie maybe has this on her radar, but, you know, I'd like to highlight again the fact that there was, when we had the interim director of mental health, Kate Bell, bringing, you know, some of the recommendations forward. She was cut short because she was only here for a year, and the inpatient services hadn't been addressed, but it was universally agreed, you know, by the groups and that Carsview was not the best site in Tayside for inpatient services, and were promised that a project group would be set up to look at other alternatives and other sites within Tayside. And I just wonder if the fact that Carsview, as well as Murray Royal, is a PFI building, whether they just want to hold on to it until the, you know, the lease is expired. But you know, that's not on. I think this has to be progressed, and I think Jackie has the intention of setting up a group to progress this really important issue, because I feel if we get, you know, that we don't need all the beds that are there, hopefully, because if they get the prevention and, you know, early intervention right in the, you know, in the community, then you won't need so many beds and that. We don't need, you know, something to sound, because that's where all the money goes, you know. So yes, trying to get them all in.
The Tayside Executive Partners comprises the Chief Executive of NHS Tayside, the Chief Executives of the 3 councils and the Area Commander. And they have been working directly with the Independent Oversight and Assurance Group, because if you look at the Living Life Well strategy, it actually specifies the role that they have in there. But I'd like to pick up Maureen's point about the reporting back, because you'll see that there is a final report required by the end of September, and that needs to be finalised and considered by the oversight group. And the text that you quoted in there is actually a direct lift from a published letter from the chair of the Independent Oversight and Assurance Group to the Tayside Executive Partners. So there's been quite a bit of communication and correspondence around how the updated progress report, the template to be used for that, and the methods for being realistic in the progress that's being made. And I think I've outlined here that once that's concluded, and there needs to be consideration around how the outstanding matters or legacy matters, if you like, that come from the Listen, Learn, Change action plan need to actually move into what would be our evolving strategy for living life well. That needs to happen. And as part of that, I think this IGB should be cited on the final report that is provided to the Independent Oversight and Assurance Group.
Thank you. Quite a lot of questions also about the nature of premises, etc., and other provision. Would that be incorporated within that response as well? Because it seems like quite a big issue.
Certainly that will be something that needs to fit into the strategy going forward, Maureen, and taken forward. If that's a matter that remains outstanding, yes.
Okay, thank you. And one final question on this from Sandra Auld.
Thank you very much, Chair. So it's indirectly related to the comment that was made about the challenges or difficulties with recruitment and retention in this area, the clinical area, but really just not to lose sight of the fact that there are sort of pan-regional difficulties in other clinical areas as well. We've talked about the difficulties in cancer services, but also a question or a concern has been raised regarding the understanding that 35% of GPs in Perth and Kinross are due to retire within the next 5 years, and just looking for some assurance that there are plans in place to be able to deal with this. I'm personally aware, just from what I'm seeing on social media and on things like LinkedIn and newspaper adverts, that Tayside are being proactive in trying to recruit. But it would be helpful if it was conveyed that there wasn't a siloed approach that was being taken, and this was the GP aspect of this was in hand. Thank you very much.
I think my reflection on that is that we just have to be absolutely clear about what we're covering within the integration scheme. I'm very aware of these other elements that you're referring to. And I think that's why us staying focused on what we are responsible for within mental health is so important. And I don't expect that to be totally clear today, because there's quite a lot of complexity in this paper. The fact that we spent nearly an hour just on this update paper tells you there's a lot of complex questions in it. Jackie, do you want to make any final comment on this before I move on, please?
Thank you, Chair. In terms of a final comment, I will just reiterate what I said in the introduction, which is that this brings an update for the first time to the IJB for some considerable time, and I'm pleased that members recognise that this is a work in progress and that we're working to bring a more comprehensive report forward in due course, and the comments that we've received this afternoon will help to shape that in the future. So thank you very much.
Thank you very much indeed. I believe that Peter and Keith are staying on for the next agenda item, is that correct? Or could be? Is there an overlap with this one? I was led to believe there might be.
They're very welcome to stay, but not vital.
I want to thank Peter and Keith for their contributions, and I should say is that there's a lot of energy being generated by the issues today. There's nothing to stop any of the members here or online from continuing to write to us with their views and comments on this, and using the routes that they already have to feed into the processes of integrated joint board. So please take the opportunity. This is only a 1 hour window that we've had an opportunity to do for this particular update. But as Jackie says, it's an ongoing piece of work, and it will take some time for us to work our way through this. But she's trying to give us timescales as much as she can do at the moment. But this is also dependent on other partners as well within this exercise. So please bear with us. But by all means, I'm absolutely grateful for the questions that we've had today, and I hope that Keith and Peter have appreciated those as well. Thank you very much. I now want to move to the next one, which is 9.3, update on the redesign of substance use services in Perth and Kinross and the implementation of MAT standards. Oh, that's fine. Thank you for letting me know.
her only son died from a drug overdose. And so I would have probably spoken this debate from our knowledge as a family, and also supporting the drug death prevention bill in the Scottish Parliament. I'll send you a note.
Thank you, Chair. And as you said at the start, it is National Overdose Prevention Day, so it is apt that the Alcohol and Drug Partnership brings an update report to the IGB today. My name is Kenny Ogilvie. I'm Vice Chair of the ADP in Perth and Kinross. I'm joined online by Charlie Cramner, the ADP Coordinator, and I think we're also joined by Colin Payton, who's the Team Leader of the Integrated Drug and Alcohol Recovery Team, although I believe he did have a prior commitment, so it depended on how the timings were running there. The purpose of this report is to update the IGB on progress in the redesign of substance use services in embedding and implementing the medication assisted treatment or MAT standards and the delivery of the priorities outlined in the Perth and Kinross Alcohol and Drug Partnership Substance Use Strategic Delivery Plan, which runs from 2020 to 23. It's recommended that IGB notes the progress in the redesign of the substance use services, also notes the progress in embedding and implementing of the MAT standards, and notes the progress in delivery of the priorities in the strategic delivery plan. I think the report asks that we request an update in 12 months. On reflection, I think we'd rather do that in 6 months just to tie in with the timescales for the refresh of the strategic delivery plan as discussed in the report. Nationally, as has been mentioned, drug deaths rose between 2013 and 2020. They did reduce slightly in 2021. And there's been a similar trend in Perth and Kinross, with 34 people losing their lives to drugs in 2020, and this figure reduced to 20 in 2021. And the number of people seeking support from drug services continues to rise. In Perth and Kinross, the number of alcohol-specific deaths has risen each year over the past 3 years, and the number of people referred to alcohol services has also risen over the past 3 years. In Perth and Kinross ADP, we are continuing to develop and implement a recovery-oriented system of care, or ROSC, which will enable people affected by substance use and their families to have access to the support they need on their recovery journey. And this includes the integration of community-based substance use services. We've got the Integrated Drug and Alcohol Recovery Team, or IDART, which was formed in 2020 with the aim of improving the effectiveness and efficiency of support for people with substance use issues and their families. The Perth and Kinross ADP has supported the formation and development of the new service by providing funding for a number of additional posts, and this investment will also support the ongoing development of the multidisciplinary assessment clinic and triage. Funding has been provided for 3 Band 5 nurses, 1 social worker with a knowledge and experience of working in mental health, a psychology assistant, an occupational therapist, and 2 recovery workers. These posts will allow the service to implement a new model which will enable a more effective response to the increasing number of referrals. The additional capacity and expertise is reducing caseloads which have been historically high, and effectively deploying staff to appropriate areas in line with their knowledge and expertise. It's also enabling an expanded range of treatment and support to promote recovery. And these include help for people to stabilise chaotic lifestyles so they are in a better position to engage with therapeutic interventions, increased access to individual and group psychological therapies, support for people to participate more readily in their local communities, and support to obtain employment, education and training. IDART is currently based in Drumhear Health Centre, and the service expansion outlined above, together with increased demand, means that additional accommodation is urgently required for IDART to operate at its maximum level and to achieve its objectives. Its current accommodation is no longer suitable, and discussions are ongoing with partners to identify appropriate accommodation in the longer term. We've also identified a number of actions to try and address the accommodation issues and provide, in particular, more clinic space in the short and medium term. Also, in terms of residential rehabilitation, which has been mentioned, there's a revised process for accessing residential rehabilitation, and this has now been implemented in Perth and Kinross, and we've also improved support for people returning home. In terms of MAT standards, there are 10 standards, and their purpose is to improve access to services and retention in services, enable people to make an informed choice about their care and treatment, and include family members or nominated persons wherever appropriate. A multi-agency MAT standards implementation group has been established in Perth and Kinross and is working closely with the MIST team from Scottish Government to implement the standards. A MAT standards implementation plan has been developed to set out the actions being taken in Perth and Kinross, and that's included in Appendix 1 of the report. Another faction in the ongoing progress is the continued development of a recovery community. There is a network of recovery cafes across Perth and Kinross that meet regularly. They were online during the pandemic, but they are all now back to face-to-face meetings, and they provide people with the opportunity of support from people with lived experience, and they also offer a range of activities, including walking clubs, fishing. I will be another 2 seconds. I'll move on very quickly. Yep. Certainly, the strategic delivery plan, which I mentioned, that is being refreshed, just given the amount of change we've had over the past 2 years. It focuses on 4 key priority areas, which are in the report. I'd like to draw particular attention to the development of the multidisciplinary non-fatal overdose pathway. While there's been good progress in many areas, there are other areas which require further action. For example, waiting times have increased over the past year. Again, a number of issues that this is related to, and we have got a number of actions identified to try and address this, which is in the report. And just to sum up, substance use continues to be a significant issue in communities across Perth and Kinross. Obviously, each death is a tragedy for the individual and their family and friends. And over the next 12 months, the ADP will continue to work with partner agencies and people with lived experience to implement the ROSC and MAT standards, and ensure that people have access to the supports and treatments they require when they need them. And I'm happy to take questions. Okay.
The work is already there for us, and a lot of people have gone through it. So it's kind of just to bring to the key points. Thank you, Ian. I'd like to open up to questions, please. There's quite a lot in this paper, and so grateful if I have Donna McPherson there.
Thank you, Chair. I think we'll probably all have got the hang of this in a couple of years' time. Thank you, Kenny. Very helpful report. I was pleased to see the level of information you gave around the progress against the MAT standards. I think it's really important that as an IJB that we continue to get regular reports on progress and how well we're doing against implementing each of these. So maybe if you can say a little more in a moment just on how you're going to keep us updated progress. So that was my question one. My second one was simply around you mentioned the residential rehabilitation and our annual funding allocation you mentioned in your paper is £137,000. That doesn't sound like a huge sum of money to me, and I just wonder how far that will take us.
Thank you for your questions. In terms of keeping the IGB informed of developments in terms of the MAT standards, like I say, we have suggested bringing a report back in 6 months' time, which will include an update. But certainly, I'm looking at my chief officer here. We could certainly provide a couple of paragraphs on progress to be included in the chief officer report at the next IGB. Yeah. And in terms of the residential rehab, you're right. I mean, it's not a cheap option. It's a very effective option if it has the appropriate supports for the people when they return to the community, as we've mentioned in the report. But yeah, I mean, costs vary, but you could be looking at, sort of certainly a 4-figure sum per week. So yeah, we just have to watch that budget, and maybe we have to try and wire money in from other budgets to meet demand as required.
Thank you, Donna. Sarah Dickey.
Thank you, Chair, and thank you, Kenny, for your paper. I just want to ask a question around section 6 and 6.1 graph regarding alcohol. I'm noticing how stark the data now is. So in comparison to 1819, 1920 and the alcohol brief intervention kind of almost success, to obviously a global pandemic impacting on many issues as to why that factor might be reduced, but then seeing only 290 for this period, that concerns me when the number of alcohol-related deaths is increasing at the rate that it is. And therefore, the actions that are highlighted in the 2 bullet points, I'm not convinced, or I'm curious to know how that's going to address getting the data to at least that of 2018, if not greater than that. There doesn't seem to be enough focus on the prevention, and it's more the intervention work. I don't see any for upstream. Thank you.
Sorry, could you just repeat which graph? Sorry, I don't have the actual papers. I'm working off my own report here. Could you say in terms of which 2.4? Oh, thank you. Yeah, my microphone's on. Yeah, I mean, the alcohol brief interventions, it's a major issue that we do need to tackle, not only in Perth and Kinross, but across Tayside, and they have dropped significantly, as you rightly say. We do need a wee bit of more work just to work out, is this an accurate reflection? It may be that certainly in primary care, the number of alcohol brief interventions is higher than that, they're just not being recorded. That said, it's almost certainly we're not getting anywhere near what our national target is, and we have part funded a post with Angus and Dundee for an ABI coordinator across Perth and Kinross just to look into this and increase the number of alcohol brief interventions across Tayside. We think this may be partly the reason for the increase in referrals to services as well, obviously, especially in relation to alcohol. And it may be that people aren't receiving these ABIs when they are visiting GPs or any of the other 4 key areas where ABIs should be getting delivered. And that is then maybe meaning people then get referred on to statutory substance use services. And you rightly say that's probably when they're further down the line as well. So we really need to get in and tackle this area. And the ABI post across Tayside is the starting point for that.
I think Hamish wants to make a comment.
Yeah, thanks, Chair. Yeah, for those who don't know me, I'm Hamish Dougal, I'm the Clinical Director for the Partnership. Just to come back to the question, and that's well observed, Sarah, in terms of the number of brief interventions, I think this probably reflects the manner of the interactions in primary care, and probably the much higher focus or use of telephone triage. But bearing in mind that that figure goes back to April 2021, so that's quite some time ago. So I think probably we'll get a better reflection as more face-to-face appointments are now happening than they were a year and a quarter ago. So that hopefully that figure will improve. But it is a challenge because there may not be a return to the same level of face-to-face appointments. So we might be tackling the problem of not having sufficient time to deal with wider complex medical issues, and giving more patients, smaller number of patients, more time But then the quid pro quo with that may be that we don't have the opportunity to do these sorts of brief interventions with as many patients if we're not seeing them all face to face. So I think we'll be interested to watch that figure and see what it is next year.
Okay, thank you very much. I think we note the progress as recommendations. Colin, did I see a late hand there?
Thanks, Chair. Obviously, we've been talking about staffing issues a lot today, so I just wanted to check. Mr. Ogilvie, you're the lead officer ensuring delivery of the plan, but reporting to you, you've got a MATS project manager. Is that post recruited to, or?
Yes, just recently they are recruited to and in place as we speak.
Okay.
Thank you. It's just really, I was going to pick up on the ABIs, but Sarah kindly did that. But what I was really wanting to comment on was the prevention agenda. This doesn't reflect to me how big the prevention agenda has been or should be. I'm linking to public health and Dr. Emma Fletcher coming on board because we talk about this a lot, Public Health Committee. And also really, I think the irony of this being the slide about anti-stigma, there's not much in here that indicates to me about as addressing the issue of people not seeking support and not seeking help. And ABIs shouldn't just be through the GPs, but it should be, you know, in every point of contact that people have with services. So it was just really a kind of reflection on the whole preventative part of the agenda, and I really admire what you're saying, and the amount of work it's doing is amazing, and it's terrible to come in and just say, but you're missing a wee bit, I think, in prevention because it's such a huge issue. But I think we need to really reference it in the round as where it plays in our communities, and particularly our younger people's services, which I've referenced a bit. Thank you.
I think just to say, I think Mr. Ogilvie is acknowledging your comments there, Beth, but to go back to the question that Donald raised around keeping the IJB regularly cited on how we're doing in relation to the MAT standards, and the suggestion put forward about bringing that within the strategic update, I think that's a sensible suggestion. I mean, we can cover it regularly at every meeting if required. Yeah.
Thank you very much indeed. And there, I think as Colin said earlier, there's been quite a lot of discussion today around workforce and staff, and that seems to me, as given where we are at the moment, to bring this back to the committee as a separate issue in its own right, because it has massive implications. And I would like to hold on to that. Another thing I want to say is that Beth raised the issue about public health input. And one of our key responsibilities under the integration scheme is about promoting public health. And I know that's also on the Chief Officer's agenda as well, because it plays into so many of the issues we've talked about, not just in this paper, but the previous paper as well. That feels like we need a substantive input soon. Thank you. You did want to say, can I take a final question then, Beth? Thank you.
Thank you. It wasn't so much another question, it was just to pick up on something you were just saying there, Bob, about looking at recruitment. And one of the things that we're talking about that in the future, could we bring in retention? Because I'm aware that with such a shortage of staff, we are recruiting people, but then very quickly losing them to other areas, such as other parts of Teesside as well. So I think it's something that we really need to address, is not only our recruitment, but how are we retaining staff, and we're not losing them as soon as we get them. Thank you.
Thank you. I think we'll let that final comment rest there, and we'll ensure that's minuted. Thank you. That now takes us on to the, and these are for noting, of course, these previous reports. 10.1, Audit and Performance Committee Annual Report. And I think is that you, Beth, that's going to lead on this, or?
I think we agreed, Jean and I was going to sneak out of this one because it's reflecting the last year, but I shall be taking part in future. Thank you, Bob.
Okay, so on behalf of our new Audit and Performance Committee Chair, I'm pleased to bring forward the annual report from the Audit and Performance Committee to the IJB. The purpose of the Audit and Performance Committee is to provide independent assurance on the adequacy of the risk management framework, the internal control environment, the integrity of the financial reporting and annual governance processes. The committee is also required to scrutinise performance and best value arrangements on behalf of the IJB. The terms of reference for the Audit and Performance Committee is attached to the paper. And this report is aimed to provide assurance that over the course of the 12 months to the 31st of March 2022, that the Audit Performance Committee has fulfilled those obligations. The paper sets out the activities of the committee, the reports that have been received, the updates that have been received at section 3. It sets out the self-assessment that's been undertaken by officers in conjunction with members, although that has been slightly complex with the change, significant change in membership of the committee. It sets out the further additional work that's been undertaken as part of the annual governance review that's been undertaken, and it sets out the position with membership and the skills and knowledge that we have on the committee. In conclusion, the report sets out that the Audit Performance Committee have fully fulfilled its responsibilities in line with its terms of reference, and wants to. This report seeks to provide that assurance to the IJB that it's working effectively and fulfilling its obligations.
Thank you very much. Other questions?
Thank you, Chair. Thank you, Jane. Just one question, if I may, around the terms of reference, where one of our remits, one of the committee's remits, is to provide assurance on best value. Now, I know certainly within NHS Tayside, that's a point that has been raised by Audit Scotland for a number of years, and they have quite a prescriptive view of how you demonstrate best value. So just, can you give a sense of where we, Perth and Kinross IJB, are on that journey against the Audit Scotland standard?
Thank you, Donald, for that question. The annual performance report that is coming to the Audit Performance Committee at the end of September sets out a section on how we are complying with the principles of best value. However, I would recognise that Audit Scotland, who are actually going to be our new external auditors, we may be able to use that opportunity to actually seek to expand and use their kind of expertise to actually expand on our best value reporting and as we move forward. So it will come forward. That's where we provide assurance on compliance, but we recognise that there's room for improvement, and we'd seek to actually to use that relationship with Audit Scotland to develop that further.
Thank you very much indeed. I don't see any other questions. I'd also be interested, Jane, in having a very thorough look at how we assurance report within our paperwork. I'm used to more different assessments of assurance and risk associated with those, and I'd welcome be part of the discussion on that, actually. Thank you. Okay, I don't see any further questions. No. Okay, thank you very much. In that case, we will note the report, and we'll move to, for information, we have the Integration Joint Board Reporting Forward Planner, which, as I say, is for information, and we have the item 12, which is the future IJB meeting dates, and the future IJB development sessions 2022-23. I should say is that that latter part around development sessions is subject to quite a lot of discussion and change. So if people wish to input into that, then please let the Chief Officer know. Okay, thank you very much indeed. It's now 6 minutes to 4. I just wanted to just briefly reflect today. It's been really good being present at a meeting, and I hope we can all come back to this because it makes such a difference. But I've really welcomed the conversations that we've had today. I think they've been enormously helpful and useful, and it's made me think quite a lot about some of the complexities of some of the issues we're dealing with here. And I think, as already been said, is that the staff, if I was to think of an issue today, I think the staffing and workforce has been one of the strongest themes of today, and about recruitment and retention, and what keeps people working in health and social care seems to me to be a kind of fundamental to that, but also being savvy around about what other opportunities are there for people as well. And we need to be aware of it, because the cost of having to go to agency in other areas is becoming pretty punitive as time goes by. So I'm kind of mindful about that, and maybe we might need to have our own think about workforce planning in terms of our own development. I think that would be helpful, because it's more than just about national issues around about pay and conditions, for example. That's something that's out with our control to a large extent. It's how can we continue to retain and attract staff here in these very, very difficult areas. And just one final point is that I know that we talk a lot about being patients, and we've talked about beds and things like that. Ultimately, we're here for a purpose, and for many of the people we're dealing with in the community, it's about independent living, and it's about enabling people to live in their communities at the end of the day. Now, there are various routes to how we could actually go about doing that. So I think it's important that we keep that bit there as to why we do this work, and it's to keep people functioning within society, even knowing that people will have long-term conditions that they may live with for the rest of their lives. And I certainly know that when we come to say a wee bit more about learning disabilities, there's an issue there about the long-term implications for us of independent living is the absolute correct policy, but some of these care packages are phenomenally difficult to resource. And so we need to continue to put up to our funders that these are the key issues for us moving ahead. So I just thought I'd say that. And thank you so much for your inputs today. Thank you very much. And thank you for staff for facilitating this as well. Thank you.